If you've ever wondered, is it normal that orgasms feel different after menopause? You're not alone. Many women over 40 quietly carry this question, often mixed with concern, confusion, or even guilt. Some notice orgasms are weaker, harder to reach, or different than they were years ago. Others worry that something is wrong with their body, their hormones, or their relationship. And far too often, these concerns go unspoken, even in the doctor's office. Here's the truth. Menopause changes many things in the body, but it does not mean the end of pleasure, intimacy, or satisfying orgasms. What it does mean is that your body is evolving, and understanding those changes can be empowering rather than discouraging. In this video, we're going to talk openly, respectfully, and medically about female orgasm after menopause. What's normal, what's common, and what's treatable. We'll separate myths from facts, explain what's happening hormonally and physically, and most importantly, talk about what you can do to maintain or even improve sexual satisfaction in this stage of life. If you're a woman navigating menopause, a partner who wants to understand better, or simply someone who believes sexual health matters at every age, this conversation is for you. Let's replace worry with knowledge and silence with clarity. Hello, I'm Dr. Thomas Spears, MD, a physician with a special interest in sexual health and healthy aging. Over the years, I've worked with countless women who felt blindsided by how menopause affected their bodies, not just hot flashes or sleep, but intimacy, desire, and orgasm. Today's video is all about female orgasm after menopause, what's normal. We'll talk about how menopause can change orgasm, why those changes happen, and what options exist to support pleasure and sexual well-being. This is educational content designed to be respectful, medically accurate, and practical because sexual health is a legitimate part of overall health. I also want to say this clearly. If you're experiencing changes in orgasm after menopause, you are not broken and you are not alone. These changes are common, but they're rarely discussed openly. My goal is to give you the information you need to feel confident talking about this topic with your partner and with your healthcare provider. If you find this content helpful, please consider subscribing to the channel. I regularly share videos on midlife health, hormones, relationships, and practical strategies for aging well. And as always, this video is for education. It doesn't replace personalized medical advice from your own doctor. Let's begin by understanding what actually changes in the body after menopause. How menopause affects orgasm. What's happening in the body? Menopause is defined as going 12 consecutive months without a menstrual period, but the changes leading up to and following menopause are much broader. One of the biggest drivers of change is declining estrogen levels. Estrogen plays a key role in sexual response. It supports blood flow to the genital tissues, maintains vaginal elasticity, and helps keep the nerves responsive. After menopause, lower estrogen can lead to reduced blood flow to the clitoris and vaginal tissues, thinning and dryness of vaginal walls, changes in nerve sensitivity, slower arousal and delayed orgasm because orgasm depends on coordinated nerve signals, muscle contractions, and blood flow. Even small hormonal shifts can change how orgasm feels. Many women describe orgasms as less intense, shorter, or harder to achieve. Some need more time or more specific stimulation than they did in the past. Importantly, this doesn't mean orgasms disappear for everyone. Some women report no change at all, and others even experience improved orgasms due to better self-knowledge or fewer pregnancy concerns. Normal after menopause includes variation, not a single experience. Another factor is muscle tone. The pelvic floor muscles contribute to orgasmic contractions. With age, childbirth history, and hormonal changes, these muscles may weaken, which can affect intensity. So if orgasm feels different, it's not your imagination, it's physiology, and physiology can often be supported. Emotional, mental, and relationship factors. Sexual response is not just physical, it's deeply connected to the brain. After menopause, emotional and psychological factors often play a larger role in orgasm than hormone levels alone. Many women in midlife are dealing with stress from caregiving, work transitions, health concerns, or relationship changes. Stress increases cortisol, which directly interferes with sexual arousal and orgasm. Fatigue, anxiety, and poor sleep, common during menopause, also reduce sexual responsiveness. Body image can be another factor. Weight changes, skin changes, or surgical scars can affect confidence. If you don't feel comfortable in your body, it's harder to relax into pleasure. Relationship dynamics matter as well. Long-term relationships may fall into predictable patterns with less novelty or communication. If partners don't talk openly about changing needs, misunderstandings can arise. Some women feel pressure to respond the same way they used to, which can actually block orgasm. Here's an important point. Orgasm after menopause often requires intention. That may mean more communication, more time, or redefining what satisfaction looks like. None of this is a failure, it's adaptation. The brain remains the most powerful sexual organ at every age. Supporting mental and emotional well-being is just as important as addressing physical changes. Medical conditions and medications that can affect orgasm. Sometimes changes in orgasm are influenced by medical factors beyond menopause itself. Conditions such as diabetes, high blood pressure, thyroid disorders, and depression can affect nerve function and blood flow, both essential for orgasm. Medications are another common contributor. Certain antidepressants, blood pressure medications, and sleep aids can reduce sexual responsiveness or delay orgasm. This does not mean you should stop medications on your own, but it does mean these side effects are worth discussing with your doctor. Vaginal dryness or pain, often part of what's called genitourinary syndrome of menopause, GSM, can make sexual activity uncomfortable, which naturally interferes with orgasm. The good news is that GSM is highly treatable with options like vaginal moisturizers, lubricants, or localized estrogen therapy when appropriate. If orgasm suddenly becomes impossible, painful, or emotionally distressing, that's not something to ignore. A healthcare provider can help determine whether hormones, medications, pelvic floor health, or other conditions are involved. Sexual changes are not just something you have to live with. Many are manageable with proper evaluation and care. What's normal versus when to seek help? Let's clearly define what's considered normal after menopause. Orgasms that take longer to achieve changes in intensity or duration, needing more direct or specific stimulation, variability from one experience to another. What's not normal is persistent pain, complete loss of sensation, or distress that affects quality of life. If sexual changes cause frustration, sadness, or strain in your relationship, that's reason enough to seek help. Normal does not mean you must accept it. Normal means common, and common things still deserve attention and care. Tips. Practical, safe ways to support orgasm. After menopause, prioritize arousal time. Many women need longer foreplay after menopause. This is normal and healthy. Use vaginal lubricants or moisturizers. These can significantly improve comfort and sensation. Strengthen the pelvic floor. Pelvic floor exercises can enhance orgasmic contractions. Communicate openly. Let your partner know what feels good now, not what used to work. Manage stress and sleep. Better rest improves sexual response. Talk to your doctor. Ask about hormones, medications, or referrals to pelvic floor therapy or sexual health specialists. Small changes can make a meaningful difference. Myths versus facts. Myth. Orgasms disappear after menopause. Fact. Many women continue to have orgasms throughout life, though they may feel different. Myth. Loss of orgasm is purely psychological. Fact. Hormonal, vascular, nerve, and muscle changes all play a role, and many are treatable. Menopause marks a transition, not an ending. When it comes to orgasm, change is common, but loss is not inevitable. Understanding what's happening in your body allows you to respond with knowledge instead of fear. The key takeaways from today's video are simple but powerful. Changes in orgasm after menopause are normal and common. Hormones, blood flow, muscles, and emotions all play a role. Many effective strategies and treatments exist. Sexual health remains important at every age. If you've been silently wondering whether what you're experiencing is normal, I hope this video has reassured you. And if you've been struggling, I hope it's encouraged you to speak up to your partner and to your healthcare provider. If you found this video helpful, please like it. It helps more people find accurate health information. Subscribe to the channel for more conversations about midlife health, intimacy, and aging well. And I'd love to hear from you in the comments. What questions do you have about sexual health after menopause that you wish were talked about more openly? Thank you for watching. I'm Dr. Thomas Spears, MD, and I'll see you in the next video.